Florida. We're waiting on one more person, so hopefully they are able to join us after all. But today I want to hand it over to Alejandro Acosta and Ariana Lint, who are going to be speaking to us about their experiences in HIV care and policy. And also, I forgot to introduce myself. So I am Joaquin Garcaño. I'm the Director of Community Organizing for the Latino Commission on AIDS, the Latinos in the South program, and I'm here in North Carolina. So I'll turn it over to Alejandro and Ariana if y'all want to introduce yourselves, share a little bit about your organization and the work you're involved in. Oh, Alejandro, I think you're on.
Sorry, let's start with Ariana. So she's alphabetically first, Ariana.
Hello, how you doing, everybody? My name is Ariana Lin. I'm sorry, I don't know what's going on with my screen, so I have the voice over here, but I am Ariana Lin. I am the CEO of Ariana Center, what is a community-based organization who empower, lift up, educate, and give services to the most vulnerable community in South Florida. We focus most on the transgender community as openly long-time survivor. I think I'm a CEO for organization who give services to the most vulnerable community. It's very important to get the voice and see what's going on over here in Florida. So I am very happy and pleasure to share my work with amazing leaders around the South Florida. So that's why let's see what's Alejandro say.
Hello, everybody. My name is Alejandro Acosta. I am sorry that I was a little late. I was having trouble with the link. I am Puerto Rican and I have been an educator for the last 20 years of my life. And the last 5 years, I've been working with HIV advocacy, starting with bringing HIV testing and STI testing to middle schools and high schools in the school district here in Broward, which is the 6th largest district in the United States. A lot of students. And then I moved into Equality Florida, which is where I work right now as their HIV advocacy coordinator. There, we have been trying to end HIV transmissions in the state, or at least curb them as much as we can. And we're doing that through a legislative effort, trying to change the laws that have not been updated since 1986. And we are also, very fast, too fast, sorry. We're also doing that through education of stakeholders. So we go out into the community and we teach, for example, lawmakers, we educate medical students. Ariana has been with me in a couple of panel discussions. We bring people living with HIV to medical students, law students, and most importantly, to the Capitol, to place them in front of lawmakers so that they can tell the story. We have never had people living with HIV come to the Capitol and lobby. And we have done it 3 years in a row. The first year we brought 10 people. Second year we brought 18 people. And the third year we brought 28 people, 18 of those from Ariana Center, or transgender people of color identifying as living with HIV or on PrEP. That's my little intro, little long.
Thank you both. I'm sure you'll have pages to share and really appreciate you giving us sort of a snapshot of the incredible work you're doing. We know Florida is truly a leader in the South in all of your policy and advocacy efforts. So there's so much we can learn from you all. And so I'm really curious to hear more about those lobbying efforts. Here we want to learn more about the policy and advocacy y'all are doing. I know this year was the first transgender lobbying day that happened right before COVID took over, and there was a partnership between you all. So what was the process to get that started? What did it look like to empower people to also speak, in spaces that people don't often feel comfortable or heard in? And so I'd like to hear more about your perspectives in that process.
Go ahead, Ariana. I know that you were unmuted, but I wanted to start with, I think that we both were at the same time. We always have our lobby days or days of action where we go into the Capitol with different issues. But I think also Ariana was working on her own, trying to set up a group of transgender individuals to come to the Capitol for lobby days. So we partnered up so that they could be, we have partnered up in the past with Zero Project, which is a large national organization working towards ending HIV criminalization in states across the nation. And so we were able to secure some funding, and Ariana could speak more about this. And also getting, it's hard enough to find people to commit to 2 days to go to the Capitol. Unfortunately, in Florida, the Capitol is really far away from everything else. So to find people to give up 2 of their days to not go to work if they're working, and to travel to the Capitol, to stay in the Capitol, is challenging. And so those logistics were not actually, I did not have to do those logistics. We secured the funding, and then Ariana can talk about how those logistics work. Because finding these people, meaning people living with HIV like myself, that have this time off and that can secure themselves a place to stay, again, is one of the challenges as to why people don't really show up to the Capitol. And they're real barriers, right? So getting rid of those barriers is what Ariana does best. And let's hear about that.
Yeah, everything what Alejandro say is true, and also, for many years I trying to working with the transgender community, specific who the most impacted be for by the HIV, and was very difficult for me when I trying to get access to support or financial support when we're talking about meaningful involvement, and I'm never see a transgender in the lobby days, and that's why I was working for many years, and make this possible, and incorporate not just the vision of the leadership, but also the vision of the people living with HIV. And in Florida, the HIV criminalization is still working, and that's why we're working when Alejandro, when the state senator Jason Piso trying to get more decriminalization the HIV. So it was very, for me, was like something, my ambition or my goal to get the whole transgender individual openly living with HIV, and Latinas, and African American to Tallahassee. But like Alejandro say, it's very difficult, specific and stay there, the time to travel, sometimes it's difficult. So thanks to AIDS United, well, we have one of the grants for the April program, what is a specific identify transgender emerging leaders, or person who they are affected for the living with HIV, and persons living with HIV, and have a more connection with stakeholders or state leaders to trying to identify co-working better for change policies. So then we partner with Zero Project and Alejandro, because I know they have a lobby day for long time, and I'm talking personally with Alejandro, working with Alejandro and the Zero Project, and we bring 18 transgender women of color to Tallahassee, and we meet with a state representative, talking specific in 2 points, what Alejandro teaches before or training us in HIV decriminalization, and in that moment the work inclusion, right? The whole work inclusion, but now we have the Supreme Court make that one possible. So that was one of the meetings or the work projects working together when the correct agencies or when the correct persons, and I think we make history because many of the transgender never see herself in the state capitol, and many of the representatives never see the transgender. Maybe they saw the numbers about the transgender, but they don't listen they don't hear the true histories behind the numbers. So it was very nice and emotive, and what that was one of the last projects face to face and in person what we have. So that's why we are maybe so emotional and feeling, because was we passed very good time with Alejandro and all people from the Equality Florida, and specific from the HIV part and the Equality Florida. So thank you.
I want to say that even finding at times people living with HIV who can openly identify as living with HIV is also a challenge, because stigma unfortunately continues to be a problem here in Florida, and in a lot of places in the United States, but here in the South, like we were talking about, just identifying as someone living with HIV can be a challenging experience, especially if you are already with intersection of other identities. So if you are identifying as transgender and then Latinx, and then maybe even you identify as a transgender woman and you're of color, there's so many intersections of these identities that can prevent someone from sharing their status, and even make it, can be dangerous. And as you know, there is a wave of violence against our transgender brothers and sisters here in Florida, as well as in Puerto Rico. I mention it because Ariana also works in Puerto Rico. She's opening and helping the transgender community in Puerto Rico advance, because unfortunately it seems like we're going in a regression in terms of the violence experience, all based on gender identity, really. Because I don't know if you've heard, but in Puerto Rico, for example, there was a murder in early February of a transgender woman. Her name was Alexa, and she was just viciously killed. And she had mental health issues. She was also a homeless person. So again, talking about these intersections that happen to a lot of trans brothers and sisters that end up at times doing emergency sex work, or homeless, or not able to even eat. So these things are things that need to be addressed. And like Ariana said, when we go and put these stories in front of lawmakers, it does an impact. It has an impact on these lawmakers. These lawmakers, a lot of the times, they are aware that these people exist, that we exist, but we are invisible to a lot of them until we actually stand up in front of them and are able to share our stories. And even if we think that one story might not, my story is not that important. No, when you are in front, like Ariana said, once you are in front of a lawmaker sharing your story, I feel, because that happened to me the first time I was ever in the Capitol, a sense of importance, and that you're actually being part of the policy making process by educating these lawmakers who might have never met anyone transgender face to face. I might have never seen or talked to someone living with HIV, and a lot of those stigmas related to even appearance might show up, right? Oh, you don't look like someone living with HIV. It's like, oh, well, let's just talk about that, right? No, and all the advancements in treatment and prevention. There are things that are there maybe every day for us, but imagine someone who is a lawmaker. I mean, we even have doctors who are not so much aware of all these advancements in specifically in HIV. It sounds crazy, I know, but I see it because I stand in front of medical students a lot of times, and you'll be surprised about the things that they don't know. They're still human. And so it's our job to really educate them.
Yes, thank you for sharing all of that. I think, 2020 has been unpredictable and definitely taken its toll on all of us. And I hope that, this big lobbying day can provide some momentum to continue working, because that was a huge win. No matter what happens in 2020, you have that day that you brought these people together, gave them a sense of voice and involvement in this policy process that, impacts them in huge ways. So I hope you think about this as a true collaborative effort. It was a huge win. Once we wrap up 2020, be like, this is what I'm going to carry with me from this year, right? So, congratulations to you both on that. You all mentioned, HIV stigma, and we've been having these state conversations, and a lot of things that happen or are brought up between community and state health officials and providers is trust. What does trust look like for y'all as a tool against HIV stigma? Y'all have to be accessible to the community. You are the community. So how do you use trust to combat, HIV stigma?
I think it's important for us to also understand that although HIV has continued to be focused on the LGBTQ community, that this needs to be a more focused effort in having what we were missing, which is a lot of public education. I think that HIV before COVID-19 had literally disappeared from public discourse. And somewhat this new emergency has also brought up HIV kind of to the surface. And in a way, I am grateful and also careful and a little worried, because a lot of the funds and efforts for combating HIV have been redirected towards COVID-19. And this new pandemic and the going virtual has also given us an opportunity to be even more accessible than before, where we are not really sure of what's going to happen next year with lobby days or with days of action. But like you said, Joaquin, we have a win. We are in the South, and we are a Republican-controlled everything, right? We have a Republican governor with a Republican Senate and a Republican legislature. And unless we make these efforts, which in this case is going to give us an opportunity now, like to get rid of those barriers that I just spoke about. So if we have our lobby days now in January, usually lobby days, the session varies in Florida. So some years it happens in January, and then some years it happens in March. Our last one happened now in January, so our next session will happen in March. But even though we have restrictions in terms of COVID, we are not sure how that lobby days will happen. A hybrid session sounds more attainable, maybe, because even though we might not have restrictions, that doesn't secure us that people might not want to come to the Capitol. The fact of the matter is the Capitol is a very enclosed space with only very old, small elevators where 15, 16 people are jammed together. And so that presents a new set of logistic nightmares, but at the same time offering maybe an opportunity to do virtual meetings with lawmakers where we might have more participation due to not having to travel all the way 8 hours, 10 hours to Tallahassee or finding a place to stay. I'm a little worried again of the uncertainty of this moment. And we can only trust those people that actually do. And we can trust those actions, right? We cannot trust words anymore. We have seen how the administration says one thing, but does another. So we can only trust those people that have shown up, that have really publicly admitted. Not everybody likes, especially politicians and at times even providers. We have very influential providers that sometimes make public statements. And we can all identify with which ones are the big providers that take up all the space in the HIV world. But we can, again, to me, we can only trust those that show up and their actions back up what they say.
Definitely. Ariana, would you like to comment? What does trust look like in combating HIV stigma in Florida for your community?
Well, trust. Well, I base my organization in trust, right? Because my whole transgender brothers, who they trust in the work, what we do, or the advocacy, what we provide, or the education. I think it's very important, the trust, and right now, like Alejandro say, I'm there trust in people who they make actions, no words or or something just they say. I think the actions they prove more and more intentional work. So that's what I'm concerning um in this and to disappear or working in the HIV was I trying to work in when agencies who they are working each other and lift up each other and the community trust too, right? Because sometimes um, uh, the community they think something from us or they expecting something from us what we don't have access or support. So that's what is very important to have the trust with other organizations, when the lawmakers, like Alejandro say, um, this year we have to reinvent everything and thinking about lobby or conversations or maybe open circle of conversations. So I don't know when lawmakers, when representatives to listen, but also how we can have access to those like Zoom or other things when many of the transgender they don't have access to those um, um, tools, right? Or update they have old phones or whatever. So um, I think the trust is very very important. And like I told you, I told you before, my whole organization based and the trust of my community, of the transgender community, the sex worker. So that is one of the important. So maybe introduce the part of the language, the like example sex worker, and the policy maybe is more attractive for more vulnerable community who they are affecting and they want to say something about them so people they can change. But in Tallahassee, but yes, it's very important. I second and I'm follow what Alejandro say all the time.
You can't worry about a Zoom link or a meeting if you're worrying about where to eat next or where you're going to sleep that night. So we have to make sure that we're tackling those also social determinants of health, and again trusting only those people that do. You know, we have had such a concentrated effort this year from the current administration in getting rid of already hard to get rights for our transgender brothers and sisters, and not just getting rid of rights, actually and actively discriminating against our trans brothers and sisters, yet saying that they are an ally to the LGBTQ community, that no one has done more to the LGBTQ community than such and such. So that's why it's important not to trust those words and just trust those actions, because we might get different, what I say, yeah, contradicting points of view where you're talking about one thing but yet doing another.
Yes, definitely. I think, that's why it's so important to have people with those very true lived experiences of, the trans experience of living with HIV to lead these efforts, because you are accountable to yourself and the people who share those experiences. Um, a lot of your lobbying efforts and policy and advocacy are centered around HIV criminalization. Um, so I'd like to learn a little bit more about what is the state of HIV criminalization in Florida, and how does it in particular affect the immigrant and Spanish-speaking community?
So in Florida, as in 34 other territories and states of the United States, HIV is criminalized. Florida is one of the strictest states, even though we don't have a sex offender registry when someone is related to or arrested or convicted for any HIV related offense. The fact is that those laws were written in 1986 and they have not been updated or revised ever since. So they still carry inaccurate information. It ignores 40 years of HIV advancements in treatment and prevention. It ignores the use of condoms, the use of PrEP, U equals U. It's still used disproportionately around the state. About 35 people each year are arrested on an HIV-related offense in Florida. Although the majority of people living with HIV live in South Florida, and only 10% of the people living with HIV live in Jacksonville, Jacksonville and Duval County carry 44% of all arrests related to HIV. So when you think about the Latinx community, when we think about the transgender community, sex worker community, we can see that the North is a lot more dangerous because those cases are also tied up to HIV and sex work, meaning those HIV-related offenses happen through sex work. And for sex work here in Florida, HIV is used as a sentence enhancer, meaning if I am, for example, I'm arrested on a solicitation charge, which literally is a conversation between a sex worker and a undercover cop, and it's just a conversation. The policeman can arrest the individual just for accepting that exchange of money for sex, and it's a misdemeanor. But it's also a sexual offense, which in Florida requires and mandates an HIV test during the process of booking and all that stuff. So if that person turns out to be living with HIV, that misdemeanor charge jumps immediately to a felony charge with a minimum sentence of 5 years. It's a problem. And when we think about HIV, we cannot help but think also of the vulnerable communities, right? The communities that are already disenfranchised, with hard access to healthcare, with no trust in the healthcare system, especially if they're undocumented. You might not, there's a problem here in Florida because we are a very transient community with lots of people who are undocumented. And when you have that mixture of undocumented and not trusting the healthcare system, because once you go and get an HIV test in Florida, you're part of the DOH or Department of Health list, which is a government agency. So a lot of people do not trust the healthcare system because they think that once they're there, they're going to be tagged and they're going to be persecuted and somewhat maybe even kicked out of the country. The fear is real. We have heard also of information being used by ICE. ICE has become a very intrusive organization in terms of how they treat people, even when they are documented, right? So you don't have to be documented to be prosecuted by freaking ICE. We have heard of citizens that are 100% Latino being locked up for a year. Give me a second.
Ariana, would you like to share? I know a lot of your work is around sex work, in the community. What has HIV criminalization looked like for your community?
I'm so sorry. I had another call that I had to take real quick.
No worries. We all got lots of things on our plate right now. Ariana?
Yes, I'm sorry. I don't know what happened with my Zoom, and then I get off, and then I have to come back. But second, what Alejandro say about the social disparities and the criminalization when the HIV specific, the sex worker, introduce that language, right, and educate lawmakers how they affect specific for vulnerable community like transgender community, trans Latinx communities. Right now, I have one of the transgender, one case, she have a charge for prostitution, and now she's holding in Miami-Dade for immigration, and then we have to see what's going on after that, because she just applied for asylum, but the social things that what happened, and we are worried about it. So it's important introduce and educate the correct language specific for vulnerable communities or the sex work community, and specific the you equal you language or message too, right? It's important to decrease and educate others. So and thanks God, we have for many years a coalition of the HIV decriminalization, led by the Zero Project and the Florida Equality and Ariana Center. And I know the lawyers from the Equality Florida, they working tenaciously to change and introduce a new law, a new language for the HIV decriminalization in Florida. So that is one of the things. We have a coalition, we have a monthly call supervising by the Zero Project, what is one of the things. And I think it's very important mention again the Zero Project, because for change law and for state law decisions or policy decisions, one of the organizations outside of Florida who they really working, and we have the trust of not just of the clients of the community, but the advocacy people like myself, and I think maybe like Alejandro, is Equality Florida and the Zero Project, because they are the Zero Project because Equality Florida from Florida, but Zero Project. So and that's it.
Yes, it's important to acknowledge our community partners and the people who make this work possible. Alejandro, did you want to share more?
No, I just came back online after getting a call in the middle of it. Thank you.
No,
I second, I go after what Ariana is saying, of course. So yeah, I have nothing to add to that.
I know, a lot of the advocacy efforts, there's the Florida HIV Justice Coalition I was reading some about. So I'm curious, what does HIV justice mean to you?
Right. So the HIV Justice Coalition, like Ariana said, is an effort, a concentrated effort of statewide organizations to end criminalization and modernize HIV laws. Justice, it's, that's one of those questions that what is justice in general? And justice could be as easy as giving more access to people, making things easier for people. That could be considered somewhat justice. But in our case, justice also means justice reform, right? And I cannot imagine, like, for example, bullying laws or stalking laws not being updated since 1986, where where we right now have bullying that happens online, very real bullying. What about if the laws would not apply or would not account for that? That would be weird. And that's exactly what's happening with HIV. There's such a dissonance between what the law says and what the real risks are. So I think that justice means giving part of people living with, giving people living with HIV the opportunity to be on par with science, at least, right? Let's just forget about the stigma part about it. Let's forget about all this stuff. Let's just give us that, just acknowledge the science, because once you acknowledge the science, the stigma right now prevents people from getting tested, believe it or not. And also the criminalization itself is a deterrent for people getting tested, because they think that once they know their status, they will be liable for whatever decisions they make sexually or not. And we need to not, by the way, HIV and COVID right now are the only diseases that are criminalized in this very aggressive manner, where in Florida, you can still bite somebody or spit at somebody and be arrested and convicted. You do not have to transmit HIV to anybody to be convicted of transmission because of the way that the law is written. We have a policeman in Palm Beach who is in jail right now for 8 years for one count for not giving HIV to anybody, transmission count. So that's justice, that people don't go to jail for things that they shouldn't be in jail for. He didn't give HIV to any of his 5 quote unquote victims because he was on treatment, and treatment works. Now, unfortunately, the law disregards that. He still has 4 more trials to go. That means that he can plead out or get up to 30 years in jail for not killing anybody, for not hurting anybody, for not transmitting HIV to anybody. And that is not justice.
Very powerful words, and thank you for that, Alejandro. And you know, justice looks different for everybody, and you know, a lot of it is, you know, not to be punished, right? And surveilled in this way. Ariana, would you like to comment on what does HIV justice mean to you?
The same like Alejandro said, justice is so difficult, but at least you can feel good and you can think you're doing good and working what you believe hard. And you be happy. There can be justice, right? Because justice is very, very, very difficult. Words like Alejandro said, many people as us, we don't believe in justice, or we don't believe in the justice of the other people say, or they think is justice for us. So I think when somebody is stable, social, economic, and healthy, that is justice for now for me.
Yeah, you know, allowing people to survive and really create a quality life, right? That is justice. We do have a question in the chat I'd like to ask you all. Someone asks, thinking ahead, what are some of the policy priorities for 2021?
Right now, we are, for example, Equality Florida is looking to expand our policy slate for HIV. We're listening to our members, and although criminalization will continue to be, or decriminalizing, right, and modernizing these laws will continue to be our focus, we also recognize that laws that other policies affect people living with HIV equally hard, like Medicaid expansion, or making sure that drug costs are low, and just even access. In Florida, for example, we are a very large state. And in my county, Broward, all of the agencies are concentrated on the east side of the highway. So if you're a 16, 17-year-old who's sexually active and wants to get an HIV test or even an STI test, you're going to have a challenge, because it's literally translates to a 2-hour ride from one place to the other, wait time at wherever center you're at, and then go back in a 2-hour ride. Imagine a 16-year-old having to explain 6 hours of missing time. And that's why we wanted to get testing into the high schools and the middle schools so that could be facilitated. Access also means that we're going to target the communities that need it. We have a humongous population here in Florida of transient people, as well as people without transportation, people with food insecurity, that once again, like we're just saying, like if those things are not taken care of, you're not going to be taking care of your own health. So the policies that we want is access, easier access and free access, continued access and more expanded access to help to testing and treatment, as well as, again, looking at this Medicaid expansion, as well as the cost of drugs. We right now are thinking of also the implementation of the ending the HIV epidemic, not necessarily being a watchdog, but really paying attention, because right now, with how things are politically, we really don't know where money's gonna go. If all of a sudden, oh yeah, we're not gonna do this, let's just do that. So again, we're just vigilant.
Thank you for that. Ariana, what policy priorities do you and Ariana Center have for 2021? I know that you have an active lawsuit, right, against the government around discrimination against the transgender community. So if you'd like to share a little bit more about that, that would be great.
Yes, we are one of the witness people who signed for against the HHS and United States, the office and this administration to for the discrimination and access to healthcare for transgender individuals and gender identity, what is very important. And we pass. We are right now looking for more experience and more witness in Florida to go to the second stage of the process. Landa Legal and the lawyers, they are working tenaciously to have and have access and put the visibility also the transgender and the highlight the and awareness the HIV and transgender community, right, and vulnerable community. So that is one of the of the points for Ariana Center for 2021 or 2020. So we just have open forum when the whole candidates and we introduce HIV questions for the whole candidate for the Wilton Manor City, where we have the office. And as you know, Wilton Manor is the example LGBT city nationwide. They want to show and prove the inclusion of the city they are. So the whole candidates as for a mayor was in the forum, and also commissioners, and that is the other story because we do it virtually and they ask questions specific in HIV and programs for take care the epidemic and also continue with the program for um, communicate or partner or introduce emerging leaders when state attorneys, state lawmakers and commissioners and people who they handle big tables, or they have a positions for helping the transgender community and a specific working together to disappear the HIV in Florida. For many years, Miami and Fort Lauderdale, they are the first and the second place. And this time, the shows prove we have a little more working, and maybe next time we're going to be out of those numbers. But I think it's because we integrate social transformation and social work with the whole vulnerables and grassroots organizations also. So that is one of the vision for Ariana Center in the 20 and 2021, and also meet together, after this COVID-19 as a long-time survivor, as a transgender, as a HIV, living with HIV. I miss my meetings in person. I miss those confrontations on or those questions and panels and everything, and have them the mental health or self-care for us as advocates, right? Because sometimes in our city we don't have too much people, like only Alejandro or something few, but when we go together we go we coming with a lot of energy. So I'm missing that too, but that's it from me.
We all are very, very busy, and we're excited about the work you all have ahead. And, how can the community support that work? What opportunities are there?
I think that oftentimes people think that advocacy means only going to the Capitol or meeting with the lawmaker, and they miss sometimes smaller opportunities for advocacy, where even talking to somebody, getting somebody involved also from that one-on-one interaction might also be advocacy. Educating people, speaking about the injustices that we're facing right now. And if you have time to donate your time and volunteer, that would be great. And if you don't have time to volunteer, staying informed and informing others is the best form of policy we have. That word of mouth. again, not everybody can get involved in a meaningful way, but I think that meaningful can be anything, including that one-on-one contact that you have with your community members, with your coworkers, with your friends. Educating your friends, your coworkers, the people that you're surrounded by educates other people as well. So I'm an educator at heart, and I believe that that is the best policy for advocacy, education.
For Ariana Center and for myself, helping to have connection with more financial resources to get more access to projects and the community. That is one of the things working together, and that's it.
And so I think we have time for one more question. So, we haven't been able to meet in person, like Ariana, you said, those conferences and those meetings are our big family reunion often, and they keep us energized, they keep us motivated. So what keeps you motivated during this time? What are you feeling excited about?
Reconnecting with my island, Puerto Rican, and also feeling a sense of inclusion of my brothers and sisters who have language limitations has been something that has aroused from this pandemic, or that has come up to my surface, which was not there before. And I'm very grateful for that reconnection, and also with reassessing priorities, and also self-care has been very important during this time. Realizing that I have right now a Zoom call on my phone, a Zoom call in here. At some point today, there'll be a lot of self-care for myself. So let's not forget about that.
For me?
For you, Ariana. What are you excited about? What is keeping you motivated?
Well, keeping me motivated is I love the life, right? I enjoy any moment of my life, and I think that is what keeping me motivating. Keeping me motivated means working hard, because I wanna see my family again in my country, in Peru. My father, my mother, she visited me every year, and this year she cannot come in yet. That is what is motivating me to go back to those simple time before, what we make you happy, and working. So that's why I'm missing that part, but I'm keeping motivated, because we know if we're working hard, those moments going to be more bigger as usual, because we enjoy better. So that's it.
Ariana's also working in Puerto Rico, which keeps her very motivated because it's beautiful. I wish I could go there so much.
For next year, we have a project in Puerto Rico to focus specific in transgender, who they are elders and HIV survivors, so more of 55. So I'm one of the office.
I'm gonna be collaborating with you again, Ariana.
Yes,
just
and one
know.
of the offices in Cabo Rojo. So I was in Puerto Rico, and I visiting the office in Cabo Rojo, and beautiful. I was very beautiful. And then I just make a one TikTok, and everybody called me and say, "Oh, you in vacation in Puerto Rico?" I say, "I'm not in vacation. I'm working, but Puerto Rico is the paradise." What can I say?
That's a great way of closing this meeting, right? Talking about how wonderful Puerto Rico is. Amazing. Thank you.
Yes.
Yeah.
Yeah, that deep connections to Puerto Rico. Work with a view, right? Who can beat that, right? Well, thank you both. I think that work sounds really exciting, Ariana. I think we often forget about our elders, and long-term survivors. So I think that's incredible. Excited to hear more about that work and how we can plug in. But thank you for this really wonderful conversation, for being honest with us, for trusting us. And we're very grateful for all you do, and all we can learn from you. So here's some more conversations like this, to reuniting in the future, hopefully very soon. Lots of self-care later. Thank you to our interpreter, and all those who have joined us today. Very, very, very grateful for you all.
Thank you, everyone. Bye.
Bye. Thanks, y'all.